Hi, my name is Hannah Garrett, and my research project was over the American emotions during the COVID-19 pandemic. The deficiency statement of this project is that we want to know the general trend of American anxiety and their concerns of the COVID-19 has not been clearly studied. The purpose of this study is to test the theory of moral panic. Moral panic is a theory that Stanley Cohen has discovered, and it's a condition or episode or person or group of people, and they emerge to become defined as a threat to social values and interests. During the pandemic, moral panic increased in the United States, along with most countries around the globe. People getting anxious about what to do, how to avoid the chance of contracting the virus, anxious about what to do if they do contract the virus, and what the public and society is going to do in order to stop the spread of the virus. The most important part of this significance of the study is to better understand moral panic, like we just talked about. Secondly, it's to identify specific worries that cause depression and anxieties and providing better services to prevent or intervene it. And thirdly, understanding moral panic can help us identify the impact of media in promoting it. The hypothesis of this study is that generational age, education level, and race have what effect they have on different emotional stresses. Because of prior research done, I do believe that generational age, mostly older generations, are going to be more affected emotionally. The purpose of this research is to test the theory of moral panic. Like previously stated, it is a condition, episode, person, or group of people that emerge to become defined as a threat to social values and interests. Moral panic is clear during the pandemic because news media and doctors have caused American society, along with other societies around the globe, to feel threatened by the COVID-19 virus, especially in the early stages. We didn't really know any medicine or treatment that could be used for it. Moral panic can also cause the increase of anxiety as well, with people getting anxious, like we said, about what to do, how to avoid getting it, and what to do if they do contract the virus. From our review of literature, like stated, I'm using moral panic theory, and there are 5 different stages to identify moral panic. Stage 1 is that a group of persons that are defined as a threat to social norms or community interests are pointed out. The second stage is that media must describe this group as a threat with symbols that can easily be recognized. Stage 3 is that a symbol that can raise public and social attention is one that is described. And then the fourth stage is that the intensity of the public's awareness overpowers the actual threat to society. And then the fifth stage is that conditions from the panic erupt and then quickly disappear with no warning. The research that I've done showed that the effects that the coronavirus had on mental health hadn't been systematically studied yet, but it was anticipated that COVID-19 would have rippling effects, especially based on current public reactions. Another worry that a lot of people saw at the start of the pandemic was losing jobs. A lot of people were concerned about the fact that a lot of people were getting laid off and losing their jobs and losing their source of income. In the research, Baker relates to the displacement of jobs to a possible increase of mental health issues, saying that exposure to a job displacement event because of voluntary or involuntary job loss stemming from a layoff, downsizing, or plant closure also has been shown to be related to a variety of adverse health outcomes, including depression, suicide, and stress. Negative changes in diet and physical health outcomes such as coronary heart disease and other psychological markers of adverse health. In a previous study completed about COVID-19, one that I got my data from, there are 13 different emotions described. Among those 13 were helplessness, depression, and anxiety, and these are all emotions that my independent variables felt, so generational age, education level, and race, all of them felt or were the subjects of this study. The data for the search comes from a cross-sectional survey collected by Yale University program. It looked at American adults aged 18 and older in the United States during April 3rd through the 7th of 2020, so just over a year ago. The sample data is stratified sampling collected for respondents in a web-based environment. Sample population are people of 18 years or older, all genders, races, education, and generation ages. The dependent variable for the study is how strongly participants feel about the emotional stress caused by coronavirus. For example, the 13 are afraid, helpless, angry, hopeful, disgusted, anxious, depressed, confused, panicked, lonely, overwhelmed, bored, or compassionate. And then the independent variables for the study are generational age, education level, and race. This research used ANOVA, analysis of variance, to test the theory of moral panic by looking at different emotional responses of participants regarding the coronavirus based on race, generation, and education level. Here is a table, kind of shows the data. We used a chi-squared table. And as you can see, generational age had a very big significance in all of the categories except for compassionate, which I kind of expected because prior to this research and other articles that came out right after coronavirus broke out, doctors were stating that it was most likely an older generation that was getting affected and that were at a higher risk of contracting the coronavirus. So the results, obviously in the table just then, there's a correlation analysis of emotional response by generation, education, and race. Results of the Pearson correlation indicated that there are some significant factors that strongly associate to emotional response. Generational age obviously having a major significance, like I said, in all emotional categories. And educational and level and race both had a total of 7 categories that were in range of significance. So in conclusion, this study helped to understand that generational age was affected the most emotionally due to COVID-19. Like I said, doctors and news reports were stating that older generations were most at risk of contracting the coronavirus, which is why I assumed they would be the most affected. Thank you, and have a good day.